much. Alone welcomes today's discussion on mental health in the context of older people and believe that the focus on the area is overdue. A significant proportion of older people experience mental health difficulties. Unfortunately, they are under-recognised, under-diagnosed and under-treated. Firstly, evidence suggests that there is severe mental health crisis among older people, which is not captured by the HSE and the Department of Health figures. Mental health difficulties among older people are under-recognised both by the medical profession and by older people themselves. Tilra research shows that 78% of older people who have evidence of depression and 85% who have evidence of anxiety do not have a doctor's diagnosis. This is also supported by Alone's data. The number of interventions to support mental health carried out by Alone has increased by almost 300% in the last year. In Q4 2022, 29% of the 1,926 older people who assessed for our services identified that they had issues relating to their mental health, but over half of those had not attended a GP for support. The Sláinte Care Implementation Plan for Mental Health needs to incorporate findings from sources such as Alone and work to capture and address the underreported mental health crisis that exists among older people. Secondly, we do not give older people due consideration as the time when mental health difficulties may emerge for the first time. We do not discuss how the ageing processes associated with age-specific psychosocial risk factors for mental health difficulties such as living alone, bereavement, physical illness, disability and cognitive decline. Without this discussion, sufficient preventative and supportive measures are not in place in the community and health services. Other social determinants of mental health relating to areas such as the cost of living and the ongoing housing crisis also are hugely important. For example, CSO data indicates that older people are among the groups most impacted by the increased cost of living. We know that considerable anxiety is being felt, which we hear when older people call Alone's National Support and Referral Line after they have received a bill they cannot pay. However, mental health problems being experienced by older people often reach crisis point before intervention is made. For example, our staff do considerable work around supporting people with decluttering and hoarding, often to enable safe hospital discharge. At times this is so severe that other services such as social work, home support workers will not enter the older person's home because of the risk to their own health. Hoarding poses a physical risk but is as a result of a psychological ailment. Generally, there is no service other than that Alone will support an older people with these processes. Organisations such as Alone who work to mitigate the impact of risk factors for mental health difficulties for older people must be adequately supported to do so. A central issue is the continuing impact of COVID-19 pandemic and specifically of cocooning on mental health and loneliness levels among older people, which cannot be overstated. Alone has assessed 1,926 older people for our services in Q4 last year. Among this group, 70% reported they felt lonely. More than 1 in 10, 11% reported that they had not been socially active for at least a year. A further 8% reported they had not been out socially in the last 6 months. Half did not record a response to this question, so the true numbers may be even higher. Increasingly, we are working with older people who have completely cut themselves off from their family, friends and community and life in general due to the fears around COVID-19, which have not subsided. Many were healthy and active prior to the pandemic. As a country, we put significant effort into telling older people to cocoon and stay inside. We offer them support to do so, but we have not done the same to support older people to re-engage in their communities. We need to identify and implement precision, research-backed interventions for the loneliness and social isolation, which is impacting this group and other groups affected by loneliness. As the co-founders of the Loneliness Task Force, we have called for action plan to combat loneliness and social isolation across all age groups for years. Development of action plans was committed to in the programme for government, the Roadmap for Social Inclusion and Healthy Ireland Strategic Plan. It has still not been completed or, as far as we can gather, even started. We've been told by the Department of Health they are struggling to find a resource. Loneliness and isolation impact physical, mental and brain health. Loneliness and depression are closely linked, and loneliness leads to outcomes like increased levels of dementia, early mortality and cardiovascular illness. Loneliness also has a strong link to psychosis and schizophrenia, until the research has shown it is strongly linked to the wish to die among older people. We've quoted repeatedly that the research shows that loneliness is shown to have severe impact on our health as smoking. Why does it not receive the same public health response? I don't believe our experiences highlight the gap in mental health policy and the provision for older people, and the lack of joined-up thinking across mental health support. The Sharing the Vision plan has specialist groups set up to progress the recommendations for youth mental health, acute bed capacity, women's mental health, primary care and digital mental health. The impact of COVID-19 on the mental health of older people has been repeatedly noted, yet there is no specialist group for the implementation of Sharing the Vision recommendations for older people. Furthermore, Sharing the Vision recommends the development and implementation of a range of actions designed to achieve the goals of the National Positive Ageing Strategy for the mental health of older people. While this is a positive action, we cannot see that any work is being done to achieve it. A list of actions that has not yet been published, and the implementation plan cites previous examples, including Alone's own work, as evidence of the recommendations being progressed. We do not believe this demonstrates significantly the commitment to progressing mental health supports for older people. I would encourage everybody present, if they've not already done so, to read the Mental Health Commission report on services for older people published in 2020, which more fully outlines the gaps in mental health provision than I can do in the time here. Unfortunately, we cannot find that things have radically changed since the Mental Health Commission's report. We are still waiting on the pilot on the model of care for specialist mental health services for older people to begin. The model was published in 2019. The Sharing Vision implementation plan for Q4 2022 reported that 4 pilot sites have been identified and others progressed, but this is taking too long. Meanwhile, the HSE's 2023 service plan reported they expected 2022 activity to be number of later life referrals for mental health services at 7,965. This is a full 1,060 people and 12% above the expected activity rate. A Dáil debate took place in April 2 years ago on COVID-19, mental health and older people. Many positive ideas were discussed and not progressed. We believe that significant action on mental health difficulties being experienced by older people is urgently overdue. We would like to make a number of recommendations. Specific mental health policy, evidence-based programs and research for older people must be committed to, funded and implemented as part of Sharing the Vision. That some be developed in collaboration with experts and stakeholders working with older people. The action plan for combating loneliness and social isolation must be completed, funded and committed to, including funding for Irish research. And older people must be provided with additional supports to re-engage in their communities in collaboration with experts and community and voluntary sectors. Organisations which enable mitigating of risk factors for mental health in older people should receive sufficient support. Mental health for older people is a hugely diverse area, and I do not have time here to address several key issues, including the rollout of social prescription, the need for safeguarding legislation, the assisted decision-making legislation, the positive impact of support and befriending on the health impacts of older people evaluated through HALO project, and research and pilot activities in mental health, including online counselling solutions for older people in partnership with Help Link Mental Health and Mental Health Reform and the Reform of the Mental Health Act, and importantly, the voice of older people experiencing these difficulties. We are happy to discuss these matters further at any time, and thank you for your attention.
Thanks very much, Mr. Moynihan.